Hello and welcome to another episode of Hair Talks by Terra Medical. Today we have Dr. Joshua Chong here. And what I want to ask you today is, there are so many doctors out there, right?
Yes.
So when I want to go for a hair transplant, right, what should I be looking out for?
Okay. So I guess it depends on what your hair transplant purpose is. If you wanted to get more beard or facial hair or eyebrow hair or scalp hair, right? So there are certain people who are real experts and have done lots of cases when it comes to facial hair and eyebrow hair, and they can do it very stylistically, very naturally, and you want to be seeking people with experience in that field out. But I think your question pertains to the vast majority of people who are just looking to get hair restoration to their hairline or their crown. Is that correct?
Yes.
So these surgeons or these people who practice hair transplant surgery for the sake of hair restorations, which there are many in Singapore as well as overseas, you want to check whether or not, first of all, they have some credentials to their name, right? Whether they are a member of any hair restoration association, whether they have good experience in doing hair transplant and good results to show for that. Right, so I guess the next question would be, how do you go about verifying this? And there are certain credentialing bodies out there that tell to the public that these practitioners are practicing ethically as well as responsibly and maintain a minimum amount of skill and experience in order to have those post-nomials behind their name, such as ABHRS, right? So that's the American Board of Hair Restoration Surgery, and they've been around for a while, credentialing practitioners that are in the hair restoration field. You have to go through a series of examinations with them before they award you the diplomate status. That also applies for the International Board of Hair Restoration Surgery. Okay. Having those credentials would put them at slightly better standing than people who do not, although there's a caveat. There are many surgeons, dermatologists, hair transplant surgeons, plastic surgeons that may not have taken part in these exams but are equally skilled and experienced in doing that. If you're not so much into researching deep into the depths of the internet, then just going to the ABHR's website and looking at their physician directory would give you some idea of who's good enough to perform your scalp surgery.
Okay, and in Singapore, I see there's a lot of hair transplant surgeon, right, in clinics that offer aesthetic services, as well as there are some surgeons that specifically work for just hair restoration.
Right.
So what's the difference between these two?
I mean, there can be people who are the jack of all trades and do multiple different kind of procedures. I'm not one of them. Unfortunately, I have lost touch with a lot of aesthetic procedures because our full-time work is largely to deal with patients who are suffering from hair loss, which is a very common condition and keeps us busy enough. So it really depends on the comfort level of the patient. If he goes into a clinic that offers the whole barrage of services, or is already a client with that clinic and he trusts the surgeon to perform his hair transplant surgery, then you still want to ask the following questions, right? Are you experienced? Can you show me what hairline design I should be getting? Show me your previous results. And what complications will I be expecting? The common questions that you should be asking any surgeon. And if you're comfortable enough to proceed, you can then sign up for that particular treatment that you're interested in.
Okay, and I mean, I heard rumors that there are doctors or surgeons that delegate the work out to their technicians or nurses to do during a hair transplant. So to what certain extent should a nurse or a technician be doing a hair transplant work?
Okay, so the ISHRS, International Society of Hair Restoration Surgeons, has actually set out in their public statements or in their publications that a list of things that are non-delegatable. So they include hairline design and consultation. So that's a doctor's job only. Nurses are not allowed to do that. It includes the local anesthesia administration. So that's the doctor's job only, because it involves critical dosing. So you cannot dose above a certain amount. You might kill the patient if you do that. Harvesting the grafts. So whether it's a linear strip excision or FUE procedure, a technician is not allowed to do that. A technician can assist the doctor in doing that. Let's say stopping the blood, trying to get a little bit of the tissue out, and so on. It includes making recipient sites. So when we are making tiny incisions over the areas that we want to put the grafts in, that has to be done by a doctor because it determines the final outcome in terms of naturalness and density, directionality of the hair, and how the overall outcome of the hair growth after 12-18 months would look like.
I mean, for someone like me, I'm actually 30 plus and I have been experiencing some form of hair loss.
Okay.
And I have been researching on like the different techniques like FUE, FUT. If I were to go to a hair restoration surgeon, what should I be looking out for when it comes to credibility? Like, should I be asking what type of techniques I should be using, or should I be just adhering to what the doctor recommends?
So I think you need to definitely do your research into this topic before you even consult, right? So where in the recent ISHRS census of 2024, it seems that the rate of FUE procedures are going down in men, but going up in women. And the rate of FUE, which is the more commonly done procedure now, is going way higher in men as compared to FUT. Okay, so there are a few good reasons for that. Being a young man, you have lots of collagen in your scalp. If we do a FUT on you, the chances of having a wider scar tend to be higher. If you do not have a limited kind of donor area, the donor area is generous enough for us to achieve the outcomes that you want, then FUE would be a less invasive technique with less risk to cause prolonged numbing or prolonged pain.
Okay.
If the doctor tells you you're only suitable for FUT, he must be doing so on good faith, knowing that your donor area is probably not the best and that a FUT will allow you to have a better outcome in the long run.
There's another question in regards to like, I mean, I have visited 2 other clinics in Singapore and I tried contacting them online,
right,
and was asking for before and afters photo.
Uh-huh.
But from my understanding is that the regulations do not allow before and after photos to be shown on websites and on like text messages.
Yeah, that's right, for a couple of reasons. So MOH has explained, Ministry of Health of Singapore has explained that before and after comparisons as well as after photos are not allowed to be shown to the public or via text message, and can only be done so in the context of an in-person consultation. And for reasons such as, it sets unrealistic expectations because not everybody is going to be able to get the same result. So the doctor needs to tell you what to expect. And secondly, these can be very easily doctored and forged. Right, so it might be a misrepresentation of the actual truth. So it's better for you to consult in person and ask them to show you their before and after photos, and you can assess for yourself from the photos, does this look like a natural outcome, which is the most important thing when you're reconstructing your hairline, and is the result good and consistent over a few different patients.
Okay, and I guess the deciding factor is probably when I go into a consultation and I feel comfortable communicating with the doctor and also assuring that the whole environment actually looks hygienic and professional. Am I right to say that?
I think that's a very baseline,
Okay.
the very minimum standard that you should be
So
expecting.
what else am I supposed to look out for?
I think one thing you need to establish with the doctor at the very get-go is you need to tell him what your expectations are, and he needs to be very forthright with you in terms of what treatments will get you to your expected levels of hair growth or hairline, and whether it's at all realistic, right? So some people would promise the sky but can only deliver a little bit of that. So you have to be careful in who you select that. And a lot of patients, unfortunately or fortunately, go for price, right? So there has to be a kind of matching with your budgetary constraints, if any. Don't always go for the cheapest thing because when you pay peanuts, you get monkeys.
For Singapore, I would say that the price wouldn't be cheap, right? In a sense.
Yeah, I mean, if you compare it against places like Bangkok, and you compare it against places like Turkey or India, the prices would never match up. Singapore is quite an expensive place to perform this procedure. But you're taking a big risk when you're going to these medical tourism hotspots because you're not sure whether they're part of the black market. The legality is there to try to curb the black market, but being in the committee of Fight the Fight campaign for the ISHRS, it's a very big uphill task to try to curb the black market in Europe as well as in Asia, because they can just close shop one day and open it as an name the next day, and you won't be able to get any recourse if your surgery was botched.
Okay, so that's the end of my session with you, and I guess hair transplant really have got a lot of research to be done before deciding on a credible clinic. So if you have got any questions, please leave them down in the comment section below, and we will see you next time. Bye.
Bye.